Bismillahirrahmanirrahim. This is Dr. Mazhar Khan. I am director at IKD, the Kidney Institute. Today's educational activity is about a lecture on a topic on the subject of medical ethics. This is in relation to upcoming curriculum on medical ethics. This subject is a part of the student selected component. This is a curriculum, short portion of a curriculum that is going to be introduced for the 4th year TMOs of IKD. We are going to introduce 4 such subjects for the student to select. So the first lecture is about medical ethics. Ethics is generally a very broad term. Ethic in our language means insaniyat. Ethics is the difference between right and wrong. As God has made us as a human being, in our subconscious, we all know what is bad and what is right. If we follow our conscious honestly, our action, kirdar, should be ethical. And this very important component of medical education is always kept at a side. It is always a part of hidden curriculum. We automatically think that the doctor, a professional, should be ethical, but we do not train our doctors in this aspect. Over the last 30 years, the people has started questioning that since there is demand of ethics from all the doctors, but nowhere in their curriculum this has been teach. So this is for the first time that we have incorporated ethics in the curriculum. Let's talk about ethics. As I said, it's a very broad term. We all knows what is ethics. Let's see what are the principles of ethics, what are the boundaries of the ethics, what is being expected from the doctor. If you talk about medical ethics or a clinical ethics, ethics is a conduct of doctor. It's a conduct of doctor and patient. There are two people there are two persons involved in practice of ethics. If both follows the ethical principle, the end result will be good. If doctor is ethical and the patient is non-ethical, eventually doctor will lose his patient and will become non-ethical, and so is the part with the patient. So both of them needs to know the principle of ethics before the situation or whatever problem has to be solved. Now about today's lecture on the contents, we are going to describe the objectives of today's lecture. What is Hippocratic Oath? Introduction to this topic of ethics, importance of clinical ethics, principle of medical ethics, international ethical codes. I'll just just superficially introduce you to these international ethical codes, duties and responsibility of the physician in general, and then in the end I'll give you a few reference subjects to do further study if you need to, and in the end a small quiz to make to wrap up the whole activity. Objectives. By the end of this presentation, the 4th year TMOs for whom this lecture is being devised will be able to define medical ethics, interpret different principles of medical ethics, value the ethical principles in their medical practice, illustrate the importance of patient confidentiality, autonomy, and the principle of beneficence and non-maleficence. We'll talk about this as we go further. Hippocratic Oath. This is one of the earliest document in medical ethics, goes back 5th century BC. Traditionally, all doctors, including myself, have recited this oath at the time of entering into the professional life. Introduction about the topic. This ethic is concerned with moral principle, values and standards of conduct. This is the WHO definition of ethics. Ethic is the study of morality, code of conduct, difference between right and wrong. Morality is the basic character of humanity. That's why I've said the ethic is not something new, it is just a humanity, a insaniyat, what we are. This is all ethics. The moral principle, if you follow, is all ethical principles. As I have already mentioned, the teaching of this very important subject always remains part of our hidden curriculum. Medical ethics deal with moral issues in medical practice. Clinical mistakes may be allowed because we are all human beings. We can do mistake, but ethical mistake is absolutely not permissible and has got legal implication if it's not been followed. So further in our introduction, a word bioethics and medical ethics and professionalism are are interrelated to each other. By bioethics is a very broad subject. Bioethics means it deals with moral issue pertinent to development in biological sciences. That means bioethics is related to issues pertinent to all human to all living being, whether it is animal, whether it is birds, whether it's a human being. Any issues among them come under the domain of bioethics, while medical ethics is only deal with practice of medicine with human being. So medical ethics is where we deal with human being. Otherwise, this medical ethics is part of a bioethics. Professionalism is a code of conduct governing the relationship of doctor with their patient, colleagues and their students. So professionalism is the practical example of ethics. This subject has become important because recently medical ethics has been greatly influenced by developing in human rights, patient awareness, experimentation, and it's mainly because of availability of this tons of information in the era of internet. Basic principles of ethics are 6. These are: number A, autonomy; number 2, beneficence. That means whatever we do should be for the benefit of the patient. Number C is confidentiality. Whatever you do, patient information, it's a privacy. You need to respect the privacy of the patient. Number D, do no harm, non-maleficence. Whatever you do, the aim is the treatment might be harmful to the patient, but the ultimate aim should be good to the patient. E is equality or justice. Whatever you do, do it for everyone. Do not pick and choose. If a patient is VIP or if a patient is your relative, you give advantage of him or the other patient. So equality, whatever you do, it has to be equality or justice among the treatment if it concerns with the treatment. And number H, last but not the least, is honesty. Now I'm going to touch each and every principle of medical ethics separately. Number 1, we start with A for autonomy. Autonomy is the patient has the right to make decision about treatment and healthcare procedure in accordance with their moral and religious belief. You describe everything to the patient, but the patient has the right to choose the treatment, which might not be the ideal for the patient, but it's your job to tell him that what you have chosen might not be in a category of A, it might be B and C, but the choice is patient. My physician choice is to lay down all the options in front of the patient and tell him which option is better, which is worse, but the patient has the right to choose. Like if a patient is a patient suffering from tumor, say a bladder tumor, I'm a urologist, patient comes to me, my expertise is to treat this disease by surgery. My inclination is surgery. This is a surgical hospital. When the patient comes, obviously I'm going to tell him that yes, you got a tumor and my expertise is to remove the bladder. I'm going to remove the bladder, which is 100% cure to you, but removing the bladder is that you are going to forego a very important part of our body to keep urine. Once if I take the bladder out, the patient will become incontinent. I'll tell the patient the benefit is you will get rid of the tumor, that the only 100% sure way of removing the tumor is to do a surgery. But other ways, the second option is radiation, the third option is chemotherapy, the fourth option is targeted therapy, immunotherapy, and so on. My job is I'll lay down all the options to the patient, and my expertise is surgery. I'll tell him, yes, surgery has got these benefits, but since you are going to lose your bladder, you will become incontinent, you are going to become infertile, you are going to become impotent, you'll be disfigured for life. This is thing, but you will live the life normally. The patient will say, what normal? If I cannot pee and I need to carry a bag for rest of my life, it's not agreeable. Then I'll tell him the second option is radiation, which is a very good option. But since I do not know everything about radiation, I'll refer him to the radiotherapist to have a session, arrange a session of this patient with a chemotherapy. Here, the meetings of multidisciplinary meetings come in play, which in all the teaching hospital we routinely do, especially for the tumor patient. In multidisciplinary committee, the patient is number one discussed among all these experts in the absence of the patient, and all of them knows about the patient history. Once the patient have an interview with me, he'll have an interview with the oncologist, with the radiologist, with the physiotherapist, with the chemotherapist, and so on. After all these interviews, patient will come to a stage where he can do a proper choice of his treatment, whatever he wants to. But autonomy means the right is of the patient, and our duty is to explain all the conditions to the patient. Here the concept of informed consent comes in. Consent means whatever treatment you want to give it to the patient, you just do not tell him, come tomorrow, I'm going to chop off your leg because it's suffering from gangrene or from ischemia, I'm going to remove your leg. No, it's not. It used to happen before, but not now. You have to, whatever procedure, whatever treatment you are going to impart to the patient, you need to provide a proper informed consent. Informed consent means describe the whole procedure, whole treatment, the background, the patient diagnosis to the patient, and then tell him all the good thing and bad thing, all the information about the disease to the patient and the probable diagnosis, and whatever you want to do, explain to him all the good things and all the possible complication to him before he can agree, and never sort of put leading question to the patient. When you describe the thing, always respect the patient. Whatever he says, listen to him. Don't sort of stop him, and never tell the patient that you do not know. If he doesn't know, it's my responsibility to make him know the condition. So informed consent is very important when it comes to autonomy of the patient. Doctor has to be very honest and professional to the patient. Never use your dignity. Whenever you are talking to a patient, always remains neutral. Do not show your emotion to the patient. Doctor can suggest but cannot enforce the treatment. This is all about autonomy. But there are some situations where the autonomy is challenged. Number one, say if the patient is incompetent, he does not have the mentality to know, if he is not mentally sound, if he is under some sort of a medication. So patient is legally incapable to take decision, usually due to permanent condition, and the court has to assign a surrogate to give a consent. These are the conditions where patient is mentally handicapped, dementia, he does not remember, Alzheimer's disease, he is in coma, he is a child minor and there is no and the parents are not available, or very old patient who do not take care of themselves and take a decision on themselves. In these cases, then the patient autonomy can be, or the consent taking in here, you need another person to give consent on behalf of the patient. Either the patient chooses a person or the court allocate a person, or in case of minor, there is a guardian. If the parents are not there, then we have to take the guardians under confidence. Number two situation is incapacity, clinically due to temporary incapacity, mental condition, dementia, Alzheimer's, psychosis. Here the doctor, in such condition, if there is no other person is available, then the doctor has got the right to decide about the treatment for the patient. In cases when there is threat force to the self or otherwise, such as usually psychiatric setting, when the patient has got a is suffering from some violent mental disorder, suicidal tendency, like if the patient suffers from some condition, say from a tumor, and if you tell him in confidence, yes, you got a tumor and a high stage tumor, and I know that the patient has got suicidal tendency, there is no the guarantee that as he walk out of your office, he'll go to the roof and he'll jump from the roof. In such condition, you withhold the information, and according to a physician judgment, better to have a family member or someone present with the patient when you tell him the diagnosis, and ask them to come to a conclusion and give you a consent about the treatment. So these are some special conditions. The next principle is beneficence. All these, whatever I am describing, is all humanities, all you know about it, but we have put it in under special headings so that you know these are all important. The second principle of ethics is beneficence. By beneficence mean whatever you do should be for the good of the patient. Apparently it might not be, like a chemotherapy. If you are going to give a chemotherapy, it's a very bad therapy. Patient will be more vomiting, he'll be anorexic, he'll lose hair, he'll become thin, he'll become pale, his blood count will go low, and he'll be predisposed to infection. But ultimately that chemotherapy is going to give him some edge. Like for renal transplantation, organ transplantation, you put the patient, you give them all the medication that takes their very important defense mechanism of immunity to zero. You make them susceptible to any type of infection, but it's for the benefit of the patient. So the main thing is whatever you do should be benefit to the patient. That's why this principle is called beneficence. The doctor should act in best interest of the patient. The procedure should do good to the patient. Patient welfare should be a priority, especially when patient is incapacitated. Then doctor should decide in the best interest of the patient. The third principle of ethics is confidentiality. What is confidentiality? It's based on honesty and loyalty, confidentiality of information regarding the patient medicine, the patient personal history, the patient treatment. All this is confident. This relation of confidentiality is the basic relation between a doctor and doctor. I mean, when you discuss a condition of patient to another doctor, always try not to lose the confidentiality. Don't tell him where the patient is, who's the patient, but you are allowed to discuss the treatment. When you are discussing this treatment in your multidisciplinary committee meeting, or you're going to describe the patient notes in your ethical committee, or in your morbidity committee, or when you are in your CPC, or you are making videos of the patient, never lose confidentiality of the patient. The patient notes, the patient history is very confident. If you lose the confidentiality and patient knows, the patient will take you to the court and will penalize you. You might lose your license. So always respect the confidentiality of the patient. These notes should be not in the reach of even medical notes should not be in reach of patient or his relatives or other colleagues. Only those who are involved in the immediate treatment of the patient are allowed to have access to the patient notes. Number fourth principle of medical ethic is non-maleficence. Do no harm to the patient. Non-maleficence. Make sure that the intended treatment do not harm the patient or others in the community. Things not to be done to the patient, avoid highs. Like example, a patient suffers from pain, he is crying, he is asking you, begging you for any painkiller. You got the option of paracetamol, non-steroidal anti-inflammatory. Then you got the option of opioids. Giving them opioids will take care of his patient, but there is a danger that the patient might become addicted. So always be selective in your treatment. Do not overdose the patient. Do not give him 10 prescription of 10 medicines, say that my prescription is very heavy and is going to have a good effect on patient. No, whatever he needs, you do whatever is good to the patient and should not harm the patient. Each and every medicine that we do, each and every invasive investigation that we do harm the patient. If the patient is pregnant and you need to do a CT scan, you don't do the CT scan. If the condition of the patient is well diagnosed on ultrasound without radiation and you want to do a CT scan for the patient and expose the patient for radiation, absolutely not. You are doing harm to the patient. Always think that you are doing good to the patient, but your treatment, your investigation, your dealing with the patient should not harm the patient in any way. So this is non-maleficence. Number 5th principle of ethic is about justice and equality. I'll just describe few examples. Fair and equal distribution of scarce health resources. Like in our setting, the free medicine for the patient, say like free transplant medicine. There are 100 people and the medicine is only for 5 patients. What will you do? You sort of ethically look around who is a deserving patient, who is a poor patient, who cannot afford the treatment, give the treatment to them. The fair decision, who should get so much, who should get the treatment first, who should be the first on the waiting list, who should be admitted, get the priority for admission. Whatever you do should be according to some values, some justice, some equality. As I've previously described, when it comes to choose between your friend, your relative, very important personality, or ordinary patient, you say let's deal with these 3 categories first and let the poor patient wait. No, priority should be patient condition, priority should be illness. A child should get the priority, a disabled person get the priority, a patient in pain get the priority, a patient with a tumor that if you do not treat the disease or the infection in time can spread and can aggravate, those patients get the priority. So whatever decision you do according to the treatment, on surgery, waiting list, admission, it should be on the line of equality and justice. The last principle of ethics is honesty, truthfulness. The most important situation is during informed consent and breaking bad news. Be honest. Do not lie to the patient. But do not scare the patient. Don't tell him that you are suffering from tumor and you are going to die. It's a very bad way of doing it. Tell them you suffer from tumor. Don't sort of understage or overstage the disease, but there is a way of telling him. Tell him that this like if the patient is suffering from tumor comes to you, you need to disclose the diagnosis. If you think that the patient is physically, psychologically not sort of fit in mentally, be truthful to the patient. Before you disclose the information, tell the patient that this is about your diagnosis. Diagnosis can be bad, can be good. Do you want to have some other person available? Should be sitting, your brother, your wife, your husband should be sitting with you. If it's a minor patient, obviously parents will be sitting, but do take them in confidence. Tell them that yes, your diagnosis has come and you suffer from tumor. Tumor means it's a growth in the body which can in certain way be treatable or not treatable. I'm going to describe the whole situation to you. Do you want someone to be sitting with you, or are you comfortable? I tell you all this. Be honest to the patient, whatever you choose. Don't hide anything from the patient, but don't scare the patient at the same time. You need to explain all aspects of patient condition and prognosis. Cultural, religious restraints are always there. When you are describing something, if it's a young girl or a female, in our culture, female, we do not, a male physician do not see a female patient in privacy. Always make sure that someone is sitting with you, either a colleague or a relative, or it's always best to ask the patient if they want to know about the whole truth. If the patient says, don't tell me anything, just tell me what to be done, respect him. And tell him about the situation patient is sitting. And if you are honest, no matter what you do, ultimately the situation will prevail in your and in patient benefit. Never lie. Explain if the patient can harm themselves, such as they are violent, they are suicidal. In such cases, it's best to have an attendant present again. So all these 6 basic principles of ethics revolve around honesty. Next slide. It's a declaration of Geneva. This broadly describe the relation of physician with the patient. It's a very simple and self-explanatory declaration. I'll just read the first 2 lines. I solemnly pledge to dedicate my life to the service of humanity. This is what the professionalism is. Number 2, The health and well-being of my patient will be my best consideration. Very good. You go through all these. This is the Declaration of Geneva, which was at first approved in 1948 and then had several amendments, and the last amendment was done in 2002. Next is Helsinki Declaration. This declaration is mainly concerned about ethical principles regarding human experiments. More specific addresses clinical research, undergoes 6 revisions since then, and the last revision was done in 2008. And I'll just read the first line of this declaration. The well-being of the subject should take precedent over the interest of science and society. Consent should always be in writing. International Code of Medical Ethics 2006 it's given by a World Medical Association. It applies both in peace and war. It will dictate the duties of physician to the patient and the colleagues. It's a long letter. It's just I need to stress that these ethical issues are being addressed on international level. Now the next slide is about duties and responsibility of the physician in general. Characters you all know, but I'll just sort of enumerate them one by one. Characters and action. The doctor should uphold dignity and honor of its profession, be honest and upright personality and hold good character, render services to the humanity, keep patient interests a priority, not his own interest, hold recognized medical qualification. If you are not qualified, do not hide, and you should be registered with one of the medical council for licensing to update their knowledge. After MBBS, throughout our life we need to upgrade our knowledge and experience, because medical field like other fields are progressing, and if you do not stay abreast with the development, so your expertise will not be needed anymore. So every year the doctor need to stay abreast with whatever new innovations are happening. You should be knowing about it. The doctor should be courteous to the colleague and to the paramedical staff. You should not, being an upright mean, you should not sort of work in isolation. You should have a proper good personality. Public and community duties in relation to the public awareness, prevention of epidemics, communicable disease, quarantine, etc. are all related to doctors. Next slide is about maintenance of medical record. As I've already described in the context of confidentiality and autonomy, detail and honest record keeping, make good use of hospital HIMS for record keeping, avoid abbreviation, and to endorse whatever you write, put your name or signature, that means the prescription has gone from you. Keep it away from the patient and unauthorized person. Display patient specific needs and highlight the special instruction, like if the patient is allergic to anything, put it in red line so everyone knows that the patient is allergic, or is handicapped, or patient is addictive, or mental condition extra if it is pertinent to the treatment of the patient. Next slide is duties and responsibility of physician in general, the same in continuity. Use generic names whenever you write a prescription. Expose unethical condition. If something going on unethically, don't just sort of keep a blind eye to it. Always expose whatever is going on, not related to you but anywhere else in your practice. If something unethical going on, it's your duty to sort of highlight that and expose that thing. Abide by the rules and regulations of the authority wherever you are working. Financial gain should not clash with the patient interest. Patient interest should be a priority. God always compensates you. If you are a good doctor, a knowledgeable doctor, a professional doctor will never be sort of will be forgotten. He'll be popular. People will come to it. Monetary, God will always compensate you monetary, but it should not be your main aim. Your main aim should be patient benefit. To treat not only the illness, patient comes as a human being, he's a personality, he's a person. Don't treat his illness, treat the patient, the whole of the patient. That means take care of a psychological need, physical need, and then treatment, and treat according to the person. Always respond to patient call in emergencies. This is the duty of the doctor. No matter where you are, always be available if it is you are in emergency duty. Refer the patient if expertise are lacking with you or in your establishment. Don't be shy of telling the patient, yes, I got a knowledge about it, but I'm not an expert. you need expert opinion, go and see if some other doctor. Never be shy of saying so. So in conclusion, the last slide, medical ethic is a cornerstone of medical practice. There should be a zero tolerance to non-ethical activities. All 6 principles should be abided. Legal implication is there in case of ethical negligence. The next slide is about a reference. Please go through this. If you got time, go through these articles. This is going to help you regarding the subject of medical ethics. In the last, I'll just put few questions to you, and just sort of these questions are related to what we have already talked about, and might be able to clarify any question ambiguities if there is any. What are the difference between bioethics and ethics? The first slide, bioethic is a broad term that deals with all living being. Medical ethics deal with only part of a bioethic, that means deal with human being. Is it ethical to entertain patient if expertise of treatments is lacking with you or in your establishment? What is the answer? No. If the expertise is not available, send the patient to an expert. You will not be legally implicated if you refer the patient to someone. This is patient legal right and your legal responsibility. If you cannot treat the patient, send him to an expert. Third question, is it ethical to interrupt the patient and ask leading question? As from third year, we are taught how to take history, never put a leading question, but don't mislead the patient. If you think that the patient is going detracking, to politely put a leading question to bring the patient back, but do not sort of stop the patient. Let the patient finish whatever he is saying, but it's the duty of the doctor. If the patient is talking irrelevant, once he's finished the phrase, don't interrupt him in between. When he finishes the sentence, bring him back to the subject where you want to. So it's partly ethical and partly, if the patient is saying something which doesn't, if he's narrating some story about his past, tell him that, yes doctor, yes patient, it's a very interesting story, but since other patients are waiting and we rather be concentrating on your treatment, let's talk about your treatment, tell me about your disease. Is it ethical to take history in crowded OPD? If there are 5-6 patients sitting and you're in a ward round, or say don't sort of loudly, it's unethical to take a history of the patient because the history involves the personal information about the patient. Always take a history in an isolated, calm place. Next question, is it ethical to examine the patient behind a curtain in a very busy outpatient department? Yes, it is unethical. The patient dignity should always be, like if someone tells you to take off your trouser and go and lie behind the curtain for to be examined, how will you feel? You'll feel disgrace. Whatever you do, patient dignity should be allowed. If it's just a simple examination of a hand, foot, or so, tell the patient, I'm going to examine you, go. But if it involves private parts and whole body examination, take the patient to the side room or somewhere, but do not do them in a crowded place where the patient dignity is in question. Last question, can you force life-saving procedure on conscious adult without consent? If the patient is bleeding, you tell him, I'm going to take you to the theater, and the patient say, no, wait, I'm waiting for my children or my wife to come before I sign the consent. Yes, you have to wait for the conscious patient. If he become unconscious, then you take him to the theater and do your good. But as long as conscious, it's his autonomy, his right to choose. Thank you very much, and we'll see you in next lecture.